part of this particular chapter, and that is the Salmonella. Once we are done with this, we are going to make an entire master chart regarding motility, lactose fermentation, urease, and IMVIC testings. So that's also going to come up. Let's finish off the last organism, that is Salmonella. Salmonella is of two types. We have typhoidal and non-typhoidal Salmonella. And for this, again, I'm going to show you a classification because fancy names are important, but please don't learn it. There's something called a Kaufman and White scheme, which you just know is used for Salmonella, but please do not get into that rat race of learning which is A, B, C1, C2, D2. That is not at all needed. You should know, yeah, there is Salmonella typhi, there is something called paratyphi, A, B, C, all that is okay, but you don't need to know this. You just need to know Kaufman and White scheme is for Salmonella. So before I begin, I can definitely see that there are some antigens that I need to play around. And I have tried to make those antigens into a little bit of a flow chart for all of you so that it's easier. So please note, there is something called an O antigen, which is somatic. Everyone knows that's in the what? That's in the cell wall, na? So that is going to be heat stable. And then there is an H antigen. We all know from general H antigen is flagella. There is also known as a VI antigen, and these are both heat labile. So learn any one, that the somatic antigen is heat stable and the flagellar and the VI antigen are going to be heat labile, and these antigens are a complex, little bit of lipid, little bit of polysaccharide, little bit of protein. So it's going to be all of it a complex. And remember, the somatic antigen is also known as the bovine antigen. Some of you will be very simple, sorted in life. You'll say, we just want to learn it. Some of you would want to know the meaning of bovine antigen. So it is basically extracted by using an acid called trichloroacetic acid. My advice, don't learn it. So it's a complex and it is also known as bovine antigen. That is the somatic antigen. If you have learned this, now I can tell you the different properties. Out of them, please note that ye jo VI antigen hai, this is the one that I am going to use for VI for vaccination. The main kaam ki baat is this. It's the one that I'm going to use for making a vaccine. But what actually happens is that it covers the O antigen. So for example, if this finger of mine is the O antigen, VI antigen will basically cover it. So tell me, this was an O antigen. If I would have added anti-O, anti-sera, reaction hota. But if it is covered with VI antigen, now if I add anti-sera, will it agglutinate? No, this will not agglutinate. So please remember, the VI is a cover. VI is a cover over the O antigen. So now what are the O and the H antigens? O is somatic, which is in the cell wall. H is flagellar, which is more immunogenic. Which is more immunogenic is going to be H antigen. Very, very immunogenic. It shows a very, very fast reaction. This means that if you will add any antibody, because this is more immunogenic, this shows you a very, very fast reaction and it shows you very fluffy, loose clumps. Whereas somatic wala, S for S, it's going to be a very slow reaction and it shows you chalky granular clumps. So how have I learnt it? Please note that when we are talking about somatic, sote it will give a reaction. Sote means it's going to have a slow reaction, number one. And because you call it the O antigen, you will see this granularity. You will see chalky granularity. Whereas the H antigen, which is the flagellar antigen, flagella ko split karo, you will get number one, it's going to be a very, very fast reaction and there are going to be loose, fluffy clumps. There are loose, fluffy clumps. So life can become simple if we want it to be. Hai na? So remember, somatic antigen of this will give a sote slow reaction and O antigen hai to ... granularity will be seen. Whereas flagellar, F for fast reaction, L for loose, fluffy. But what's the concept? Why is it giving a fast reaction? Because it's highly immunogenic. You studied the basics, but I told you there is something called Salmonella typhi, Salmonella paratyphi A, Salmonella paratyphi B. Okay? These are the Salmonella that you have. Remember, the O antigen is going to be the game. Means when I say game, I wanted to say that it's everywhere, it's the same. So game khel gaya wo. Game khel gaya means the O antigen says whether it is typhi, paratyphi A, paratyphi B, I'm going to be the same for everything. But the flagellar antigen is the one which is going to help me in differentiating. Means when I say O antigen ke saath reaction hai, you will say, ma'am, it could be for typhi, paratyphi A, paratyphi B. Really doesn't matter. Whereas for flagellar antigen, I will have a separate flagellar antigen for typhi, separate flagellar antigen for paratyphi A, separate flagellar antigen for paratyphi B. And remember this, because these 4 antigens are going to help you very soon in a test called Vidal. So the O antigen, I'll say it's the same for everything, whereas the flagellar antigen is different for everything. And VI antigen, I've already told you I'm going to make a vaccine out of it. Okay, so before I go on to all of those clinical features and all of that, please note that there are some antigenic variations. If O antigen is lost, H antigen is lost, VI antigen is lost, is that known as antigenic variation? So tell me, if the H antigen is lost, ma'am, flagella is lost. This means the flagella is going to be lost. This is very simple to learn. If the O antigen is lost, O antigen is what? O antigen is the somatic antigen. O antigen is the somatic antigen, or you can say it's something to do with it's the cell wall, isn't it? So I am saying that till the time the O antigen was present, everything was going very, very smooth. Now when the O antigen is going to be lost, things are going to become rough. Why? Because there is loss of virulence. So remember, till the time the O antigen was present, life was very, very smooth for the bacteria, because the bacteria had a lot of power. When you have power, life is very smooth. But when that O antigen will go away, the virulence will go away. Then the bacteria will get to know that I have no value. Then life is going to become rough for this bacteria. So remember, smooth is when the antigen and virulence is there. Rough is when the O antigen and virulence is not there. Coming to the last one, the VI antigen, the vaccine wala, that is lost and that changes into W. So VI, if it is lost, that will change into W strain. So nowadays there is a lot of Salmonella which are VW. VW means intermediate forms. Kind of they have lost the VI, kind of they have it. So these are the intermediate forms. ये नहीं भी याद रखो चलेगा. This you have to know that H antigen lost means flagella lost, O antigen lost means virulence is only lost. Life has become rough. Now let's talk about Salmonella typhi, or you know what we're talking about. We're talking about enteric fever. So first we'll talk about the pathogenesis, the clinical signs and symptoms, and then the diagnosis and treatment. So when I say enteric fever, in simple words, you call it typhoid fever, and enteric word definitely tells me that this is to do with the intestine. So what is the pathogenesis? Of course, you know that typhoid क्यों होता है? Put your common sense. Typhoid is because of consumption of contaminated food and water. So fecal-oral route, and the infectivity dose is 10 to the power 3 to 10 to the power 6 bacilli that you need. So it's definitely not small. It's a decent amount of infectivity dose that you definitely need. So what is the cell that is going to enter? So please remember, in the intestine, it's going to enter the M cells. In the intestine, it's going to enter and bind to the M cell. So if I draw this as the Salmonella, it will enter the M cells. From there, it will go into the submucosa. It will go into the submucosa. You will say, okay, ma'am, the submucosa basically has a lot of macrophages and all of that. Will they kill the Salmonella? No. They will resist the killing. Why? Because they have SPI, Salmonella Pathogenicity Island. God has given it a Salmonella Pathogenicity Island, which will make sure that no one can kill it. It can survive, it can spread, it can invade, it can take its wings out. So basically the strength of a Salmonella is a Salmonella Pathogenicity Island, which will allow it to spread, to invade, not to get killed, for survival. Sabke liye Salmonella Pathogenicity Island, and ultimately from the submucosa, it's gonna go into the lymph nodes. It's going to go into the lymph nodes, and we know that whenever kaun sa lymph node, intestine hai to mesenteric lymph node, right? And we know that if something goes into the lymph nodes and then goes into the lymphatics, it has a probability of going into the blood, and that means that is primary bacteremia. Primary bacteremia means it has come out into the blood, but while roaming around in the blood, where is it going to go to? While roaming around in the blood, it is going to go all the way to the organs, like it can go to the liver and the spleen and other organs, for example. And from those organs, it will again come out into the blood. Again come out into the blood. Can I now call it secondary bacteremia? I can call it secondary bacteremia. I've told you the detailed pathogenesis for you to listen to once and then just know that primarily what happened. Question number 1, it went into the M cells. After that, it survived and went to the lymph node. From the lymph node, it has gone into the blood. So primary bacteremia, then roaming around from the other organs, it again came into the blood. So then that was secondary bacteremia, right? So what are the conditions and what are the, the different features? I think everyone knows there is a very, very famous step ladder pattern fever that you see in enteric fever, that it is going to remain stable and rise, stable and rise. So there is a step ladder pattern fever. I hope you remember in pathology, where did you see stepladder electrophoresis, stepladder DNA pattern, and that was seen in apoptosis. Hai na? So this is the stepladder apoptosis pattern. This is stepladder fever of typhoid. Okay, what ulcers in the GIT? So if you remember, typhoid, I have always told you, again I've taught you in pathology, typhoid, ty is wound longitudinally. So the ulcer that you have is longitudinal ulcers. You end up seeing longitudinal ulcers. What diarrhea? The very famous pea soup diarrhea. They love to destroy these words. Pea soup diarrhea. Now, another thing. Whenever you have fever, you expect that the heart rate will go up, tachycardia. But over here, the heart rate goes down, and that is known as the Fagot's sign. That is referred to as the Fagot's sign. I told you it's going to go to different organs. There's a soft palpable liver and spleen possible. And on the second or the third week, there are rose spots that are seen. And if you put pressure on the rose spots, they are going to fade. They are going to fade when you put pressure on them. So now, out of these, the questions that I expect, fancy names favorite hai. What fever? Stepladder. What diarrhea? Pea soup diarrhea. What kind of tie longitudinally pehnoge? To longitudinal ulcers. Also, whenever you have fever, you expect tachycardia, but here it goes into bradycardia, that is Fagot's sign. Similarly, on a blood test, you will say, ma'am, it is an acute infection. Acute infection, what cell goes up? Neutrophils go up. But remember, in pathology, I taught you this is an exception. Here, the neutrophils are not going to go up. Here, there's going to be relative lymphocytosis. Here, there's going to be relative lymphocytosis that you see. So again, an exception. I was expecting the heart rate to go up, but that went down. I was expecting the neutrophils to go up, but the lymphocytes went up. That is what is typhoid. Now further, you need to know how are the carriers. Everyone's heard of the carrier. There was one carrier who shed typhoid Mary, the cook, the famous cook, typhoid Mary, who cooked in so many houses and spread it to thousands and lakhs of people, because carriers are those who shed the organism in the feces and the urine. So stool or urine carriers, दो type के carriers हैं, stool carriers, urine carriers. That is one differentiation, whether someone is a stool carrier or a urine carrier. Urine carrier matlab it's somewhere in the bladder, and stool carrier is basically the carrier site is gallbladder. So site of carriage. Second is duration. If someone is in the recovery phase and is carrying the organism, that is somewhere between 3 weeks to 3 months, that is the recovery time, that becomes a convalescent carrier. After 3 months till 1 year, that becomes a temporary carrier, and anyone beyond 1 year will become a chronic carrier. So simple, during the recovery phase, 3 weeks to 3 months convalescence, 3 months to 1 year temporary carrier, beyond 1 year is going to be a chronic carrier. So now coming to finally the point, how will you do the diagnosis? And there's a very famous mnemonic called BASU. How have we divided BASU? That is depending on which week the patient has come to you. Week 1, 2, 3, 4. So please note, in week 1, you would prefer to do a blood culture. In week 2, you would want to do an antibody test. An antibody test is known as a Vidal test. In week 3, you would want to do a stool culture. And in week 4, you will want to do a urine culture. But guys, this is very strict. It's not that 7 days, 14 days, 21, not like that. Yes, there can be an overlap. Antibodies can come in by early days also and can persist longer. Stool culture can come positive earlier also. This is just a way of learning. Blood culture, antibody, that is Vidal. Stool culture, urine culture, week 1, 2, 3, 4. Let's start with blood culture. Lots of blood culture techniques are known. So remember, they take blood and culture fluid in the ratio of 1:10. And this is usually a lot of broths that are there. So bile broth can be taken, glucose broth can be taken. And you know, many people, because they were having diarrhea, so maybe they were having antibiotics. So to remove the antibiotic effect, you might want to add SPS. If you want to learn sodium polyethanol sulfonate, you can, not needed. SPS is added to basically remove antibiotic effect. On the other hand, they are also saying that you can use the Castaneda medium. You can use the Castaneda medium also. That is also important. So please note, these broths and Castaneda media are basically used for the blood culture. Now, first week was blood culture. Next week was antibody, which is going to get you the maximum tests. Maximum question comes on Vidal test. That Vidal test is a test for testing the antibodies. And when is it most reliable? In week 2. So it's highly sensitive, agreed. but it is not specific. I'll first give you an example. When the first wave of COVID came and when, people started recovering and everyone started making antibodies, we realized suddenly in my lab I was going through the reports of the last, trying to correlate things because COVID, we were all trying to do our best and find out something extra out of it. So I saw that suddenly there's a spike of typhoid cases in my lab, and I found it very weird that everyone's suffering from COVID, but why are people simultaneously showing me a lot of Vidal tests positive? I realized that Vidal test is a very non-specific test. Any antibody produced for any other disease will give you Vidal test positivity. So because in that time everyone was going through COVID and recovering and having antibodies, that is the reason that those antibodies were cross-reacting and giving me a positivity with Vidal also. So yes, you will see positive, false positives. For example, you can see it with infectious mononucleosis, that has a lot of antibodies. You can see it with malaria. Malaria season, suddenly you will see the typhoid Vidal is going high. SLE is an autoimmune disorder. It has so many antibodies. Of course, they are also going to cross-react. So the problem is that this is a non-specific test, which means if you do just one test, you can't say a patient has typhoid. You will have to do multiple testings, means you will have to do paired testing. There will have to be a gap of 2 weeks that you will keep between two tests, and you will have to see how much increase in the titer, a 4-fold increase in titer. So today, if you've done a test of Vidal and you feel it is positive, after 2 weeks, you should see that the antibody titer has become 4 times. Then you'll say, acha, ye genuinely wala typhoid Vidal hai. Or maybe if the titer falls, then maybe it was some other disease that resulted in it. So now, what is the principle of Vidal? Of course, you know that these are the two antigens that you have, the O and the H antigen. So I'm going to start off with those. But first, I need to give you the principle. See, there is something known as a slide Vidal and a tube Vidal test that you have. But before I get to that, I need to tell you what is the principle of Vidal. So before I go to slide and tube, my concept is that I have learned up till now that we have an O antigen, and O antigen is played the game. It has said I'm going to remain same for all, para typhi A, B, C, typhi sab ke liye. Whereas, so I can write, just if I write TO, that will mean that this is for typhi, paratyphi, sab ke liye. But when I'm talking about the flagellar antigen, that is different for Salmonella typhi, Salmonella paratyphi A, Salmonella paratyphi B. So how do I write it? If I write TH, this means it's for flagellar antigen of typhi. If I write AH, this means paratyphi A ka flagellar antigen. If I write BH, paratyphi B ka flagellar antigen. Has everyone first and foremost understood the terminology that I will be using? So how many antigens am I testing for? I will have 4 antigens in my lab, and from the patient's blood sample I will find out where is the antibody present. But now you need to learn a mnemonic, that is OH. So this is your next part that you will learn, and there's so much. First I want to put myself safe. Before you guys send me screenshots of different books and Q-banks and apps and say, man, you taught OH, but over there something else is written. Let me tell you beforehand, OH is just a very, very basic way of learning. Most of the cases it is not even followed. But please note, when I'm talking about OH, O antibodies are the ones which they say that are first to appear. Then next to appear in the blood are going to be the H antibodies. Then the first to disappear from the blood is also going to be the O antibodies, and the last to disappear in the blood is going to be the H antibodies. This is what all the conventional books say, and give it 2 minutes extra, but listen to me so that you don't have confusion with other platforms and other books and MCQs while solving. I'll tell you what to mark also. So please note that all the old wala books say OH. That is, O antibodies will come first, O antibodies will go first. H antibodies will come later, H antibodies will go also later. So OH, come first, then come second, go first, go second. Okay? So now if I tell you these scenarios, I'm not telling you the controversy, I'm telling you the old school method. If I go to this scenario, look at this. The O antigen, same for all. The H antigen of typhi, the H antigen of paratyphi A, H antigen of paratyphi B. Now, if I say the reaction has come to O antigen, you will say, ma'am, typhoid to hai. But whether it is typhi, paratyphi A, paratyphi B, that I don't know. For that, I will have to look at this. The flagellar antigen of typhi has come. This means this is a case of Salmonella typhi. Let's look at the next. Over here, O antigen reaction has come to typhoid to hai. But the H antigen has come for paratyphi A. This means which strain is this? This is paratyphi A. Next, The O antigen reaction has come, typhoid to hai, but this time the flagellar antigen for para-typhi B has come. So the answer is para-typhi B. So I realized the O antigen will to come in all because it's common. Whereas the flagellar antigen come, that will give me the diagnosis on whether it is typhi, para-typhi A or para-typhi B. Now comes that OH-OH controversy. If they say that this is an early infection, so if they say only reaction with O is there and all the others have come out to be negative, then you will say this is an early infection because the first to rise was O, this was an early infection. Whereas they say that now everything is negative, only H, ya to iska H, ya is any one H, either the H of this or this or this, any one H is there, you will say H was basically the one that was the last to leave. We had studied that H will appear second and will go also second. End mein aayega, end mein jayega. So this is going to go in the end. This means I am referring to a late infection. I am referring to a late infection. Okay, coming to the last, if only the O antigen is not there and everything else on this planet is there, means the H antigen of all of them are there, why is O antigen not coming up? Because someone has covered the O antigen, VI has covered. This means the patient has received vaccine. So if vaccine has been received, then the reaction with the O is not going to occur, but the reaction with all the others is definitely going to occur. So repeating once again, that if you get only O antigen reaction, this means it's an early test. If you get only H antigen, this means it's a late test. And other than O, if you get all the H's, that means it is going to be a vaccine. Now all is done. This is seeming so simple, but what's the controversy? If I ask you a question, out of O antigen and H antigen, which was the one which was more immunogenic? The one which was more immunogenic was H. You'll say, ma'am, when H is more immunogenic, why are you saying that it will come second in the blood? When it is more immunogenic, which creates a greater response, H should be the first one to come in the blood. Exactly. Now I am contradicting my own statement. If MCQ आया, because this is such a varied test, now you cannot fit it, some things you can't fit into MCQ, some things are patient related. I can't put them into one option. So I'm telling you what to mark in the exam, I'm telling you what you'll see in your clinical practice. Clinical practice mein to OH dikhega. OH, and this is how you're going to do the diagnosis. If O is there, early infection. If H is there, it means it's a late infection. You will do OH for your practice. But if MCQ comes and they ask you, which is the first one to appear in the blood, the first to appear and which is going to be more immunogenic, please mark H. Please mark H because the correlation for MCQ is going that way, that H is more immunogenic and that is why it should come first, but that will not help you in your diagnosis. That will not help you in your diagnosis, okay? So diagnosis ke liye practicality OH for solving these questions OH, but what is the titer? So the titer for every state is different because please note that the titer, you must have seen every Vidal report has in the end the titer of 1 is to this much is significant. Har state ka alag hai. They go as per the endemicity and the population there, but gradually books say 1 is to 60 for O and 1 is to 180 for H is said to be double almost. 1 is to 60, 1 is to 180 is going to be double, triple for that matter. That is going to be the titer, but this will change and most likely they will give the titer to you in the exam that what do you have to consider significant. So I'll give you an example. This is what a slide Vidal test looks like. Can you see over here? Pehle to NCPC, negative control, positive control. Don't focus on that. Focus on your 4 main things. This is the O antigen. This is the flagellar H, flagellar of para-typhi A, flagellar of para-typhi B. And I can see that there is an agglutination. This is just a schematic diagram. So I could see an agglutination. I've tried to show you every possible variation that how the agglutination and clumping is gonna come up. But like I said, this is a lot of false positives. So now we have new tests called typhi-dot and dot-blot. These are basically card-based tests which can help you in knowing the antibodies. So nowadays what we are doing is going to be the typhi-dot. So now what are you done? You are done with the blood culture. You're done with antibody. If you have to do stool and urine cultures, what are the culture media? Do I have to teach you this? I told you one story of sisters. The Salmonella and the Shigella sisters is what I had told you about. So tell me guys, what is the enrichment media for Shigella that you studied? Selenite F broth and tetrathionate broth. This you have studied. Then what is it for the selective media that you studied? XLD, DCA, SS and HE. Have we studied? So something with deoxycholate should come. SS मतलब Salmonella Shigella sisters का एक आगार है, and HE is hectin enteric. Enteric word will tell me enteric fever. So this was same for Salmonella and Shigella, but you'll say, ma'am, there has to be a point where you differentiate between them. And this is the recent FMG as well as the NEET PG question, and that is the Wilson and Blair medium. So tell me, who created a fight between these two sisters? There's a boy named Wilson. He came and these two sisters ended up separating. Till now, everything they were together. Wilson and Blair came and created a problem. So remember, Wilson and Blair is something that you will see only for typhi, and typhi is gonna get jet black colonies like you see over here. So please note, Wilson and Blair medium is going to be for Salmonella typhi, and what you're going to get are gonna be the black colonies. Very important. So who created a fight between Salmonella Shigella sisters? It's the Wilson and Blair. Now we come to what is the IMVIC testing. There is minus, plus, minus, plus for Salmonella. How am I going to learn this information? See, for Salmonella, I told you antigens OH. For Salmonella, we did OH. Those antibodies hai, IMVIC is also like that. O ka negative bana do and H ka positive bana do. So what is it? It is minus, plus, minus, plus. Minus, plus, minus, plus like OH. That is going to be for Salmonella. Let's move on to the next. What are the other tests? I have already told you. Have I told you neutrophils will never increase? There will be relative lymphocytosis. Ho gaya. For the students who are second year students, there is a Phage typing which is done. A and E1 Phage is very important for Salmonella typhi. Ratta question if you can. MCQ skill, it's not important. But Phage typing helps you differentiate different organisms. Finally, coming to the last part of Salmonella typhi, and that is the vaccine. So you all know now we have a live oral vaccine called typhi-oral. Typhi-oral TY21A. Typhi-oral. If you want to go into the details of this vaccine, please note that T121A is going to lack an enzyme called UDP galactose epimerase. Kya hai ye enzyme? Till the time this enzyme is there, the organism is going to survive. I have removed this enzyme, so when this oral vaccine will be given, within 4 to 5 divisions of the bacteria, this vaccine is going to die off. Basically, the bacteria is going to die off, and that's what is needed. Na? You don't want the illness to occur. You just want 4-5 divisions should occur, immunity should be formed, and the bacteria should die off. So how have you maintained? Otherwise, the bacteria would have kept on multiplying and patient would have had typhoid. So you've kept an enzyme called UDP galactose, that is epimerase present. If you can learn it, UDP galactose epimerase, this is lacking. This has been removed. So when this enzyme will not be there, after 4-5 divisions, the bacteria is going to die off. So that is the live typhi-oral vaccine, typhi-oral. You're going to give it as an oral route. There's also the TY2, that is typhi VI vaccine, that is TY2 vaccine. VI vaccine hai, so you know that VI antigen has been used in it. Now, what other typhoid species do you know? Just one slide about it. There is something known as Salmonella gastroenteritis. Gastroenteritis. This is a type of a non-typhoidal Salmonella. Remember the first slide I told you, typhoidal and non-typhoidal. Typhoidal wala you've done, typhi, paratyphi A, paratyphi B and all of that. Now we come to non-typhoidal. Salmonella gastroenteritis hoga. So gastroenteritis is one name. So you'll say, ma'am, gastroenteritis is so telling me that it is causing some gastroenteritis like enteric fever. But you said it is not caused by Salmonella typhi. What is it caused by? It is caused by typhimurium or enteritidis. So remember, gastroenteritis is either caused by typhimurium or by gastroenteritidis, and of course this is also going to have a source of food contamination, meat, milk, and a short incubation period of 1 day, right? So this is going to have all kind of fever, vomiting, for that matter invasive diarrhea can also occur because of this, and the treatment is usually going to be supportive. So repeating once again, when I'm talking about Salmonella gastroenteritis, so gastroenteritidis will definitely come to your mind, but please note typhimurium is more common. Iska most important question is typhimurium is more common. Similarly, Salmonella can also cause septicemia, and who is going to cause septicemia? Cholera suis is going to cause septicemia. So Salmonella cholera suis is going to cause septicemia. Septicemia means firstly all organs are affected, whether it is the heart or the lungs or the bones, osteomyelitis, sub effect hoga, and it is going to have a fatal rate. So in the non-typhoidal, there is a gastroenteritis. Repeating, who causes it? Typhimurium, more common than enteritidis, and then there is a Salmonella septicemia caused by cholera suis. With that, we have definitely wrapped it up, but this one table is very interesting for me, which I have to pick up because I know students kind of are scared of this the most. I've got you all the members of this family. First tell me, remember I told you all of them are motile. Which are non-motile? I said illa. Klebsiella, non-motile. Then I said, okay, Shigella, non-motile. Salmonella motile hai, but I told you in Salmonella there is Gallinarum and Pulorum. Salmonella Gallinarum and Salmonella Pulorum, these are the ones that are non-motile. The rare wale Salmonella are non-motile, and Yersinia we had studied Yersiniosis, Listeriosis, differential motility. May or may not be motile. So basically the illa are going to be non-motile. Salmonella may of course the rare wala. Okay, motility done. Talking about lactose, KK wala sounds were fermenters, means E. coli, Klebsiella, Enterobacter, Citrobacter. All the coli, KKK ones were lactose fermenters. So remember, when you're talking about lactose fermenters, E. coli, Klebsiella, Enterobacter, Citrobacter. They are lactose fermenters. All of the others are non-lactose fermenters. Now let's come to urease. Guys, urease, I gave you a mnemonic called punch kiss, which had everything, but the two organisms that it had of this family was P for Proteus and K for Klebsiella. So Klebsiella and Proteus in this family are positive. So urease wala is also done. Remember, urease gives you a pink test. Punch se bhi pink hoge, kiss se bhi pink hoge. So that is going to be urease. Finally comes the IMVIC testing. Firstly, if I differentiate E. coli and Klebsiella. E. coli was plus, minus, Klebsiella was ulta, that was minus, plus. Then if I ask you, there was a mnemonic called I am shy, means Shigella and Yersinia had methyl red positive. Dhundo, Shigella, yes, methyl red positive. Yersinia, yes, methyl red positive. Finally, Salmonella. Salmonella was that Vidal test wala, OH. So I had learned that instead of learning OH, you will learn minus, plus, and that is also done. Others you don't have to learn. Whatever I have told you, only that much information repeating once again for all of you. When I talk about E. coli, plus, minus, Klebsiella, minus, plus. I am shy tells me methyl red is in Shigella and Yersinia. So Shigella mein methyl red, Yersinia mein methyl red, and Salmonella mate is going to be OH. OH is going to be minus, plus, and this entire family is over. I know it's lengthy, it's one of the lengthiest gram-negative organisms we have. Other ones are thankfully chota, but I hope you've been able to understand it. Quickly tell me your question. What is the indicator that we used in the CLED media? CLED was that blue color wala media, so the indicator used was bromothymol blue. But what is the indicator that I used in McConkey? McConkey had a mnemonic called plant, and N was for neutral red. Coming to the next question. Okay. CLED media is considered better than McConkey. For which reason? Did I tell you that CLED was more comfortable? It was allowing everyone to grow. So, firstly, does it differentiate lactose from non-lactose? That both of them do, no? That's not a difference. Both of them differentiate. Both of them prevent the swarming. Both of them will inhibit the growth of others, but which is less inhibitory? Who will allow gram-positive organisms to grow? CLED. So that is why it's better. This is a previous year AIMS question. Which organisms causes hemolytic uremic syndrome? If I don't read the options also, there are two organisms, enterohemorrhagic E. coli and Shigella. What do I have? They've not even asked me the details. They've just asked me E. coli over here. So that is very, very simple. Coming on to the next one. Diagnostic test of entero-invasive E. coli. Invasive, it's going to be the, of course, invasive E. coli, Serine test. That is how we had written it. Serine test is going to be entero-invasive E. coli. Coming on to the next question. There's a 65-year-old diabetic man who presents to the emergency room with a severe productive cough, having a thick, bloody sputum resembling currant jelly. So remember, when they are talking about a red currant jelly sputum, currant jelly will remind you of Klebsiella. Also, I know Klebsiella is lactose fermenter, so on McConkey it shows the pink colonies which are mucoid. Of course, Klebsiella is not only going to be pink colonies, but is also going to be mucoid. So that definitely gives me currant jelly sputum with pink colonies and mucoid. Of course, it is a classical case of Klebsiella. Coming to the next, which of the following shows stacked brick appearance on cell lines? Stacked, aggregate ho gaya. Which one? Entero-aggregative E. coli. Entero-aggregative E. coli. Coming to the last question that we have over here. The blood of the patient was connected or suspected to have pyogenic liver abscess, was sent for culture. The morphology shows large mucoid colonies with a positive string test, stringy mucoid. Only someone with a capsule can have it. And again, the answer becomes Klebsiella. Yes, that can cause a liver abscess, but that's not the point. It can cause anything in the